In this video, I'll explain Sever's disease, what it is, how it is assessed, and how physiotherapy can help. We'll focus on clear advice, hands-on treatment where appropriate, and progressive exercise rehabilitation to restore capacity and confidence. Sever's disease, also called calcaneal apophysitis, is pain arising from the growing part of the heel bone, near where the Achilles tendon attaches. It is common in active children during growth spurts, particularly in sports involving repeated jumping and running. Despite the name, it isn't really a disease and it doesn't cause permanent damage to the heel. Pain is normally felt at the back or underneath the heel and worsens with running, jumping, and prolonged activity such as sport. The heel may be tender when squeezed from both sides. A child might limp or walk on their toes after activity, and either one or both heels can be affected at the same time. Symptoms often fluctuate depending on training volume, playing surfaces, footwear, and periods of rapid growth. Sever's disease is usually diagnosed clinically without needing a scan. We'll ask about the child's age, recent growth, sports, training changes, and how the heel responds during and after activity. The examination may include heel tenderness and the heel squeeze test, as well as ankle movement, calf flexibility and strength, foot control, walking, and hopping. Imaging is generally unnecessary unless there's been a significant trauma, the symptoms are unusual, or recovery isn't following the expected path. Physiotherapy helps the child and family manage activity rather than simply stopping all sport indefinitely. We might temporarily reduce running and jumping, shorten training sessions, or replace some activities with lower impact conditioning. Manual therapy can include ankle and foot mobilizations, soft tissue treatment to the calf when stiffness or muscle guarding is contributing. This may help pain and movement, but it also works best when combined with exercise and sensible load management. Exercise begins by restoring comfortable ankle movement and introducing calf loading at a manageable level. Calf raises can progress from double leg to single leg, then heavier resistance. Foot, hip, and leg strengthening may also improve running and landing control. Skipping, hopping, and running are then generally reintroduced before returning to full sport. We use the child's response later that day and the following morning to decide whether the exercise and activity levels are appropriate. Heel cups, heel lifts, supporting footwear, or even different types of taping can reduce symptoms for some children. Research suggests that several conservative approaches, including physiotherapy, heel lifts, and monitoring the condition over time, can improve pain. However, no single option is clearly the best for every child. We therefore choose these supports based on the child's comfort, activities, footwear, and their individual response. They can reduce symptoms, but they don't replace progressive exercise and load management. Sever's disease eventually resolves as the heel's growth area matures, so it doesn't continue into adulthood. Symptoms can still fluctuate over several weeks or months and may return temporarily during growth spurts or increases in training. Sport can be progressively increased as walking, hopping, and running becomes more comfortable, and there is no significant increase in symptoms the following day. The key message is reassuring. The heel isn't becoming permanently damaged. Good education, sensible activity modification, manual therapy where helpful, progressive strengthening, and appropriate footwear support can keep most children active while the condition settles.